Hey there, it's Raj from 3CB Performance. Pelicans announced that Zion Williamson will make his season debut on January 22nd against the Spurs following surgery on a lateral meniscus tear and extended rehab that focused on modifying Zion's movement patterns, aka movement retraining or repatterning. Through reporting from ESPN's Andrew Lopez, Baxter Holmes, and comments from Pels GM David Griffin, and from Zion himself on the Ringer pod, we learned the movement changes focused on things like landing and jumping mechanics, knee alignment, gait or running analysis, and as Griffin said, quote, improving Zion's breaks. In the following video, I'll go through each of those topics with an emphasis on why it's important, possible changes, and how to assess carryover to actual games. First things first, I want to clear up a misnomer that Zion was, quote, relearning how to walk. That's very much an exaggeration, and that term is typically associated with patients with acute neurological deficits who are rehabbing post-stroke or traumatic brain incident, TBI, and learning how to walk again. In Zion's case, the Pelicans were most likely modifying certain higher risk movement patterns that tend to place and accumulate undue stress on specific body regions. With that in mind, let's get to the first modification. Zion, David Griffin, Andrew Lopez, and Baxter Holmes each mentioned that the team was working with Zion to stop his knee from dropping inwards during movement. This is biomechanically known as, quote, knee valgus, and results in gapping and tensioning the medial inside of the knee while compressing the lateral outer aspect of the knee. The latter is especially pertinent in Zion's case since he's coming off a lateral meniscus tear. Generally, knee valgus is associated with increased knee injury risk, especially ACL injuries. Knee valgus can manifest in a number of movements, including squatting, running, on-court cuts and jump stops, and jumping and landing, to name a few. The first task for the Pels rehab staff was to discern the root causes of the knee valgus. Commonly, it's due to hip abductor weakness that's addressed with targeted strengthening, ankle dorsiflexion range of motion deficits that's addressed with targeted mobility, and neuromuscular deficits that are addressed through techniques such as external cueing, in which you use a band during movements to enhance proprioception, external feedback with the staff telling Zion what he was or wasn't doing, film analysis, and reciprocal self-feedback and self-correction with the mirror. Zion and Baxter Holmes both mentioned that the rehab team was also working with Zion on jumping and landing mechanics. These mechanics are incredibly important because they're high force movements. For example, research on athletes indicates that landing results in an average ground reaction force, GRF, think of it like a shockwave traveling upwards through the legs, of 5 times body weight. In Baxter Holmes' piece, he wrote that when Zion was tested for landing GRF by biomechanical sports specialist Peak Performance Project, P3 for short, Zion generated the highest reading they'd ever seen for an athlete. Therefore, landing mechanics are even more important for him. In addition to assessing the aforementioned knee valgus during jumping and landing, which is unfortunately all too common in basketball players, there are a multitude of other things that Pels rehab staff may have been looking for. On a macro scale, athletes tend to bias towards either a knee-dominant landing strategy that puts more stress to the anterior front part of the knee, like the patellar tendon and the quads, or towards a hip-dominant strategy that puts more stress to the posterior chain, glutes, hamstrings, lumbar extensors. Typically, and especially in Zion's case who's dealing with knee issues, you want to train the athlete to be hip-dominant and allow the large, high-force muscles of the posterior chain to absorb the huge landing force. This probably comes as no surprise, but landing on one leg puts significantly more force to the joints. Even more concerning is that single-leg landing also results in significantly more variability in terms of lower body alignment, with a much higher chance for high-risk positions like knee valgus. The research shows that landing with an extended straight knee, a quote stiff landing, versus landing with a flexed bent knee, a quote soft landing, results in nearly 20% less force absorption by soft tissue and a much larger load on the joints. The research shows that the specific angle of the ankle at landing significantly varies the amount of landing GRF. In fact, it may be the most critical variable to reducing or increasing force through the body. To that point, landing with the ankle at 40 degrees of plantar flexion versus landing with 0 degrees of plantar flexion nearly doubles the amount of landing GRF, from 3.24x body weight to 6.5x body weight. The key for the Pels rehab staff in all-terrain landing/jumping mechanics is again figuring out the root causes. For example, if Zion was lacking hip flexion mobility, extremely common in athletes, that made it difficult for him to get into that hip dominant position, then they would have worked on his hip mobility. Additionally, it could also be ingrained neuromuscular patterns. Zion has been jumping and landing in a certain way for years, and those patterns have become second nature. In that case, like knee valgus, you have to work on breaking those movement patterns via external cueing, movement priming, film analysis, and feedback. It's not easy and takes significant extended work. Baxter Holmes' article made mention that the Pelicans rehab staff was analyzing Zion's running gait, specifically looking at which part of his foot was touching down first, also known as Zion's foot strike pattern during the quote initial contact phase of running. Foot strike is typically categorized into rear, mid, and forefoot strike, with most individuals falling into rear or mid, even those who claim to be forefoot strikers. For someone coming off injury like Zion, it can be helpful to transition to a midfoot strike because research shows it can result in decreased peak impact force. Additionally, the rehab staff may have Zion focus on shortening his running stride length, also referred to as increasing running cadence or increasing running stride rate. There's consistent evidence showing that a shorter stride results in decreased vertical excursion, ground reaction force, and energy absorbed at the hip, knee, and ankle joints. In my opinion, decreasing stride length is the lowest hanging fruit for any recovering athlete in a running sport because it's relatively easy to change with potentially huge results. Changing foot strike and stride length is often one and the same process because a shorter stride length biases toward a midfoot strike. The first step is calculating stride rate by counting how many times one foot hits the ground during a minute of medium pace running. Multiply that number by 2, and that's your stride rate, aka running cadence. The aim is to increase that number by 5 to 10%, which will result in the aforementioned benefits while not increasing energy expenditure. A cue and mantra I found works very well with my patients and clients is quote, chop your steps. This will help you shorten your steps, and it'll certainly feel choppy at first, but then normalize with practice and familiarity. Griffin commented that they were working on quote, improving Zion's brakes. What that likely means is the rehab team is improving what's known as eccentric control. Eccentric control and contraction occurs when a muscle lengthens while contracting and helps slow down the opposite motion. In other words, quote, braking. For example, during a controlled descent on a biceps curl, the biceps is lengthening while contracting to quote, brake that descent. This braking mechanism results in better movement control and less force into the joints. Key eccentric muscles for Zion include his quads at the initial contact phase of running, his hamstrings during terminal swing phase, and his quads, hip extensors, and lumbar extensors during jumping and landing. In each of these cases, the muscles serve as brakes and dissipate force. Accordingly, the Pels and Zion were likely working on targeted eccentric strengthening. Eccentric training puts significantly higher stress on a muscle than concentric stress, and is typically most associated with developing delayed onset muscle soreness, DOMS, so Zion may have had some really sore days. The other aspect of eccentric training are parts we already touched on in detail, modifying movement technique. For example, changing to a hip-dominant landing strategy shifts eccentric load to the posterior chain, which are stronger and better equipped to handle that level of force compared to the quads. The Pels rehab staff may be using a combination of their own movement observation expertise, video analysis, force plates, and EMG analysis to determine if Zion's movements are changing. When Zion gets back, the main question becomes how well the movement repatterning is carrying over to the games. A key thing to understand, and I can't stress this enough, is that Zion will have a natural variance where he's fluctuating between old and new patterns and somewhere in between. The research consistently shows that not only is this fluctuation normal for new motor skill acquisition, but that these mistakes and variance are a critical part of learning new motor patterns. They're fuel for the nervous system's fire, and further, that variance will only increase as intensity and stress levels ratchet up. Therefore, we have to view carryover and movement repatterning as a trend line rather than as a straight line. The Pelicans' extended approach to Zion's rehab and clean up his movement patterns is an extremely wise decision for Zion's future, and their rare transparency has given us a valuable peek into a generally lesser known sphere of movement science and movement repatterning. It's a long, extended process, and one that will continue for many months after Zion gets back onto the court. Old habits do indeed die hard, but movement quality is critical for Zion's health moving forward, far more than his playing weight. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis. You can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel and follow along on all social media for the latest updates. 3CB out.